Senator Wiklund.
Thank you, Mr. President. Yes, we've had a long discussion, but I think it's been a good discussion that we've had today about issues that were of concern and of interest to the minority party. I wanted to talk about just a few, and I will keep this brief, but a few of the things that I have concerns about with this bill. You know, I think that there are some good things in the bill, and those have been mentioned. I will support Senator Benson's mention of the extension of MA coverage for postpartum women for 6 months. I think that's a good start. I hope that as we discuss the bill and the conference committee discusses it, that we can see if there's a way that we can make it a 1-year coverage for postpartum women. That would line up with their child, and I think that having access to health care for a 1-year period will be have a significant impact on maternal health and children's health. And it would make sense over time. I think we'll see benefits in savings because women will be getting the health care they need rather than delaying and having more severe health care needs. So I think that that is definitely a very positive aspect of the bill. Some of the things I have concerns about, as was mentioned, the way the bill uses the capitation payment delay, I think is a large negative. We need to be responsible in our budgeting and shifting costs from one biennium to the next. It's not only, I think it's harmful for the budget that we're trying to deal with right now, but it's also harmful into the future and forces future legislatures to deal with a very significant over $100 million cost in a future biennium. The lack of having a discussion about different ways that we could address healthcare coverage, I think it's disappointing. We had the discussion about just including a study so we could get started in understanding what some alternatives are to our current healthcare system. That was not accepted today, and that's disappointing. I think that we should be looking at how can we better structure our healthcare system so that more people have adequate and high-quality healthcare coverage, as opposed to our current system where we are investing many millions in dollars into one small segment of the market, the reinsurance, the individual market. I think we need to have more imagination about how to do better going forward. The study would have been one way to do that. And so I'm disappointed that we weren't able to include that in the final bill. Prescription drug costs are addressed somewhat, but I think that today we missed an opportunity to talk about 2 other different methods, and we weren't able to have a full discussion about prescription drug affordability board and the formulary change, which could really help consumers see lower prescription drug costs and manage their prescription drug costs. So I'm disappointed that we weren't able to have that discussion today. The bill includes a drug reimportation plan, but I really don't see that. We don't have very much information that will have a significant effect. Drug companies can choose to lower their costs now, and so the potential savings, I think, are questionable. The bill also, another area, cuts funding to the SHIP program. I've heard from my local public health agency that they need not only their local public health grant funding, but the SHIP funding is essential for work they're doing. They're doing work in the community to address child nutrition, tobacco prevention, and other really significant projects, and they feel that the SHIP program has been demonstrated to be a helpful program in addressing health care issues or health issues in our state. And then, you know, the reinsurance plan is included partially in this bill, partially in the commerce bill. Again, I think we could be doing better than going ahead with a 5th and 6th year of reinsurance. It spends significant money to support that segment of the market. And this year, we already know that for 2022, there will be significant federal assistance to consumers because of the cap on the expenditures by consumers to 8.5% of their income. So that will have a significant impact. This is the time we should be looking at what are we going to do in the future and not just going ahead with reinsurance. And then, we had a long discussion about the language to license abortion facilities. I think it was, I'm disappointed that we weren't able to remove that. That's an unnecessary aspect of the bill. I hope that, that is not something that will move forward in conference committee. Just a couple other thoughts about the spending in the bill. It doesn't include operating adjustments for the Department of Health or the Department of Human Services, or as I mentioned earlier in the day, the Department or the direct care and treatment areas. I think that this will have a negative impact on the agencies and would likely force cuts, and that will impact jobs and services. There are other areas that I could comment on, but overall, I think the bill needs a lot of work. I hope that through the conference committee process that it will come back in a better form. I would suggest members vote no as it goes out of the body today, and I commit to working with Senator Benson to help improve the bill and make it something that will address Minnesotans' needs going forward. Thank you.